Doctor, was that a private or public or total knee replacement? It was a step-by-step knee replacement. You may have a partial or uncompartmentalized one, is that correct? Well, we call that a unicompartmental knee replacement. What does it involve? It involves the end of just one bone, that is, the tibia or femur, or a total knee replacement. And, doctor, in which the ends of both bones and often the patella are renewed, is that correct? Well, it is a total knee replacement that you are referring to. And is that by far the most common, doctor? Yes, it accounts for over 90% of cases. Doctor, the artificial joint that is inserted is known as what? It is known as a prosthesis. And if you had more than one prosthesis, doctor, what would you call it? You would call it prostheses. Doctor, for a total knee replacement, the prosthesis consists of two polished metal alloy components. Is that correct? Yes, it is correct. And it is usually based on titanium. Doctor, also cobalt chromium? Yes, titanium or cobalt chromium. And that replaces the ends of the long bones, is that correct, doctor? Yes, and a high-density plastic liner or polyethylene which sits on the tibia to separate the two from the femur. Doctor, sometimes the back of the patella is also resurfaced with plastic? Yes, with plastic, and most prostheses are held in place with a bone cement, such as polymethyl methacrylate, which dries quickly. Doctor, some prostheses are cementless? Yes, they can be cementless, and specially textured or coated to encourage a new bone to grow in and secure them? That is correct. The screws or pegs are used to stabilize them until bone growth accelerates or occurs at all. Doctor, these require a longer healing time, do they? Yes, they do, than cemented joints. And sometimes, doctor, a hybrid technique is used, is that not right? Well, in which the femoral component is inserted without cement, but the tibial and patella components are cemented in. Doctor, is it not true that once the patient is asleep, the anesthesiologist injects a muscle relaxant? Yes, such a drug is used to reduce tension in the leg muscles. And, doctor, a tight tourniquet is used or applied to the thigh to stop blood flow to the leg. Is that not correct? Yes, that is correct. And the surgeon makes an incision, does he? Yes, he does. Where is that incision made? The incision is down the front of the knee, that is from 8 inches to 12 inches. Doctor, you are referring to 20 centimeters. Is that correct? Yes, 20 centimeters to 30 centimeters long, depending on whether you are having a partial or total knee replacement. Doctor, is it not true that the incision may be made with the knee straight or flexed? Yes, it depends on what the surgeon prefers. And that preference, doctor, is in the quadriceps muscle, which may be cut enough to allow the kneecap to be turned over or pulled to one side to expose the knee joint? That is absolutely correct. The joint capsule is then opened, which is what we call an arthrotomy. And this orthopedic surgeon is using an oscillating saw to prepare the surface of the tibia bone. Is that correct? Yes, that is correct. It is for the replacement knee, however. And full protective clothing is worn during a knee replacement? Yes, it is, because they fragment bone easily, and those fragments are thrown up by an electric saw. Doctor, with the knee flexed to 90 degrees, retractors are used to hold back and protect the soft tissues and the knee cap. Is that correct? Yes, it is correct. The damaged lower surface of the femur is removed with a special electric saw and shaped using a special cutting guide. Doctor, is that to fit the new artificial femoral component? Yes, it is. And it is using a template. Holes are drilled up into the lower end of the cut femur to locate the new prosthesis. Too fast?
No, I think I got it.